When we talk about heart rate, it can be measured directly or indirectly. But right now, I'm going to talk about indirect heart rate assessment that is done by palpating the pulse. Pulses are palpated using finger pads of the index and middle fingers. You want the pressure applied to be firm, but not so hard to occlude the artery. Radial pulse is usually used to measure heart rate. It is found at the radial side of the forearm at the wrist. After you find the pulse with finger pads, then you can use the fingertips to compare rhythm and amplitude. Rate simply means number of pulsations or beats felt in 1 minute. For example, you will be documenting something like 70 beats per minute. When you see the term rhythm, this refers to the regularity of the pulsations, meaning time between each beat. So if rhythm is regular, you can count it for 30 seconds and multiply it by 2. That will give you beats per minute. If you find rhythm to be irregular, you do want to spend full 1 minute counting that rate. It is a common practice or customary to take and compare pulses on both sides of the patient's body. Brachial pulse is found on the inside of the arm at the elbow. Carotid pulse is located on the neck, but with this one, remember not to check both sides at the same time because it reduces blood flow to the brain and your patient might pass out if you do that. If you're unable to palpate a pulse, use Doppler to amplify sounds of the pulse. Pulse amplitude. That is the strength of the pulse, and there's a grading system used. So if you cannot feel any pulse at all, count it as 0. That would be absent pulse. But if you ever find somebody with no pulse, you want to do something about it. You cannot just kind of go ahead and document it as such. If the pulse is diminished or barely palpable, it will be documented as or rated as 1+. 2+ will be normal. If you feel like pulse is full volume, that will be 3+. And your book talks about 4+. They're calling it bounding. I have never, in my experience, documented anybody's pulse as 4+. Your chapter 12 has more detailed information on upper and lower body pulse points. Please make sure to go over those. I also want you to think about a few variables that could cause changes in heart rate, and then compare them to what's in your textbook. Let's go over respirations. Respiratory rate is the number of complete ventilator cycles per minute. Ventilatory cycle means inhalation and exhalation. Men usually use their diaphragm while breathing, which increases the movement of the abdomen. Women, on the other hand, tend to be thoracic breathers, which is noted with movement of the chest. You can count respirations for 15 seconds and multiply by 4, or count respirations for 30 seconds and multiply by 2 to obtain respirations per minute. And please get used to stating those full units when you're saying. Don't just say 18 respirs. Say 18 respirations per minute. Try to count respirations when your patient is not aware, because if they become self-conscious, it might change their breathing patterns. So this is a technique that I use. When I'm checking their heart rate, or if I'm checking their radial pulse, I just tell them, I'm going to be in your personal space for over a minute, so don't be alarmed. So I check their radial pulse for, if I'm doing it 30 seconds or 1 minute, then I add extra 15 seconds or 30 seconds at that time and count their respirations too. Now I want you to think about factors that might affect respiratory rate and compare it to what's in your textbook. With respirations too, you want to note the rhythm, if it's regular or irregular. Note the depth of the respirations, if they're deep, normal, or shallow. Quality should also be noted. Normal breathing should be even, quiet, and effortless.